In this video vignette, we'll be discussing warts, causes, and some treatment options. We hope you find this video informative. The medical name for warts is verruca vulgaris. Well, what are warts really? Warts are a very common, benign, non-cancerous growth of the skin that's induced by infection of the skin with a family of viruses called human papillomavirus, or HPV for short. This virus can be transmitted from person to person through direct skin contact, or can also be transmitted simply by touching inanimate objects. For instance, you can get plantar warts on your feet from swimming pool decks, dressing rooms, gymnasiums, this sort of situation. The wart is often described or named depending on where it occurs in the body. For instance, warts that occur on the palms of the hands are called palmar warts. Warts that occur on the bottom or the plantar surface of the feet are called plantar warts. Warts can occur almost anywhere in the body. When they're in the groin area, they're called genital warts or condyloma. Planar warts, planar means flat top. These are small warts that often occur, for instance, in the beard area of the men, legs of women, and can be easily spread by shaving. Warts usually don't cause symptoms, but can be painful or sore if they're in weight-bearing areas of the feet, or if they occur in the hands where they're sore if you're trying to grip. And most people just don't like warts because they're unsightly. Warts can occur at any time during life, but they're certainly most commonly seen in childhood, the first 2 decades of life. As we get older, we become relatively resistant to this infection, and if we've had them before, we usually don't get them again later in life. Males and females are both equally affected by this infection. What do warts look like? Most of us recognize them. They're flesh-colored to tan to brown sometimes. They're rough on the surface, round. Sometimes they'll be grouped into larger warts. They can be very, very small, ranging in size from sesame seed size to greater than a centimeter. The most common places to see warts are the places that we bang around all the time. Our hands, elbows, knees, shins, feet, but almost any area of the body can be affected. You may have heard of seeds. These are described as the tiny dots that occur on the surface of warts. Well, these have nothing to do with infectivity or contagiousness, but really what these dark dots represent are tiny blood clots in the loops of capillaries which extend upward into the skin, into the wart itself. They're meaningless, they're just part of what is a wart. Warts, again, not usually difficult to recognize, so the differential diagnosis or list of potential possibilities is usually pretty limited with warts. They are harmless, and warts do eventually go away. In fact, 2/3 of warts within about 2 or 3 years will go away spontaneously whether you treat them or not. So we always offer our patients the option of treating. If they're completely without symptoms, you can just wait them out. If they bother you, you can certainly treat them. There are many, many treatment options available, however, for warts, because no one treatment option works very well. If you wish to learn more about specific treatment options available, watch the video vignette on treatment of warts.